Good evening and happy Valentine's Day, and welcome to Korman Plastic Surgery. I'm plastic surgeon Josh Korman, and I would like to welcome all of you to our evening program on breast surgery. There are a lot of new things and exciting things, and I would encourage all of you to stay until the end because we'll have a Q&A where I will personally answer all your questions, and also anybody who stays to the end gets registered automatically for our raffle. But besides that, we have a lot of special savings for all of you and a lot of good information, and I look forward to talking to you. This evening we're going to talk about several different breast options. We're going to talk about breast augmentation. That's for increasing volume, and that can be both with implants or with fat transfer. And we have some very special new implants which are really changing the whole shape of the market. So we have the implants or we have the fat transfer. Then for many women who need some amount of a lift, with or without volume, we'll be talking about the different options for breast lifts that are, the medical word is mastopexy. And then for people whose breasts are larger than they would like to be or too heavy for them, we'll be talking about breast reduction. And we also have some additional techniques that really help with some skin tightening, that minimally invasive, with technology called Renuvion. So we have things that are new, Motiva implants, Renuvion. So all these things are new in the breast horizon, and we're happy to share them with you today. So let's talk about breast volume. It's easy to think, oh, just take fat from my body because it's my own stuff and then just stick it in the breast. But the thing is, it's not like you have a closet full of fat that whenever you need it, you can pull on it and put it wherever you want, and whatever you're going to take out is going to stay, and it's going to be the same, and it's going to make it soft and all that. It doesn't quite work that way. Many people that want fat don't actually have enough fat. Plus there's the whole question of when you take the fat out, what happens to the skin. The way I like to think about it is, if you're really mostly interested in liposuction, and oh, by the way, if the fat that's coming out, instead of throwing it away, maybe I can put it in my breast, that is a totally logical way to think about it. If you are thinking more, I'm trying to increase my breast volume, in my experience of many years, implants are a much more reliable way to achieve what you want. It's not that you can't achieve it in certain cases, but with fat, but it is different when you put fat in the face, it's different than fat in the breast. So there are many, many choices for implants, and it's good. I'm happy to talk to anybody about whether you should use fat, because I've done it many, many times, or implants. But there's certain things that you're trying to accomplish when you're doing increasing breast volume and things in the breast. One is the superior pole fullness. It's when we're young, we have more volume at the top part of our breast. As we get older, gravity and loss of breast tissue, and also breastfeeding and all those other things that happen in life, we tend to lose the superior pole fullness. And breast implants are generally a much better way to give you superior pole fullness. Also, implants are more reliable in amount of volume and where they'll stay. And there's lots of ways to put implants above the muscle, below the muscle, and incision locations around the nipple, under the breast, under the arm. I've done thousands of these in all these different directions, and I'm very happy to accommodate whatever your personal requests are in line with what works for you as a patient, that it's safe and reliable and beautiful. So I want to show you the different implants we have. There's saline implants, which is essentially a water balloon. This is a saline implant without water in it. Advantages: if it breaks, in the very unlikely case it breaks, then you know right away because it would deflate. Downsides is that there tends to be more chance of rippling, and they're a little heavier than silicone implants. Then we have silicone implants, where they are come in several, they're all round, but they come in several levels of profile, how far they come out and width, and that's part of the process of measuring your basic breast size, because we want you to have really good cleavage but not too much width. You don't want to feel fat when you walk. So how does it sit? So there's different ways that they can be lower profile and higher profile. You see this is higher. And then the newest implants that I'm very proud to show you are called Motiva implants, and these are different in that the silicone is different and the shell is different. They have a different kind of safety profile, and they have been around in other countries for 14 years. They're in the United States, they're fairly recent to the market, and I'm very excited to be having the ability to provide these to my patients. So there are many choices for breast volume, and the future is really yours. So now let's talk about lift. And it's really not so much lift as it is position, breast position. And breast position, as I'm sure you all know, changes over time. And how we relate to it and what we do about it is important, like in everything else in medicine, to diagnose before you treat. So first, let me show you a diagram here of what breast ptosis, meaning breast droop, happens. So this is, and I realize that different ethnicities are a little bit different, but in general, this is normal. And then grade 1 when it's a little bit down, grade 2 when it's lower, but the nipple is still not pointing down. Grade 3, the nipple is pointing down. And then there's something called pseudotosis, where the nipple seems like it's in the correct position, but the breast sags below. And then there's what's called, it's a big word, parenchymal maldistribution, basically when the tissue has all come down. It used to be up here and now it has come down. So there are a lot of different ways and techniques to get the breast to look and to be where it used to be or where it should have been. And I use a lot of different techniques to do it. I am much more a non-algorithmic based breast surgeon. I do it till it looks beautiful. And some of it is measuring, but a lot of it is from experience, what looks right, moving tissue, because what happens to the skin and the underlying tissue, they don't all go together. And so you need to keep thinking in 3 dimensions to craft a beautiful breast. And so I use techniques of taking out skin. I always try to do the least amount of incisions that are going to, so they'll end up with the least amount of scarring. One particularly strong opinion I have is that I don't think it's good to create a scar that goes too far to the center or too far out to the side. Because if it goes too far to the center, which is often done when you do an anchor type incision, where an anchor, if you think of the circle at the top and then down and the anchor, if the middle part of the anchor goes too much to the center, then if you're wearing low cut clothing, I don't want anyone not to be able to wear the clothing they want because of the scar. So I don't do it that way. I do it as minimally as possible so that you can choose whatever clothing you want. Similarly, I think it's important not to make the incision too far to the outside, because I want every woman to be able to wear a tank top if they want to, or a skinny bathing suit, whatever they want. And so I work really hard also to make the incision very short. Now in breast augmentation, the incisions are very, very short, like this small. In mastopexy, then you need a longer incision. Now a lot of women are very concerned about that they don't want cuts in weird places. So I just wanted to assure you that the whole idea is that that you can have an incision that's around the areola, and that actually looks very invisible in many cases. Then if you need a vertical incision between the bottom of the areola and the bottom of the breast, that you actually only see if you're pulling up your breast. Many procedures you can go to Google University or ChatGPT to really learn what to do. With breast surgery, you actually can't. You need to come to somebody who's had a lot of experience to help guide you of what's the right thing for you. So whether it's volume with fat or volume with an implant, a lift either with a non-invasive technology such as Renuvion or minimally invasive, or surgical, and what kind of lift, what kind of incisions, what kind of combinations with implants or a lift with fat or implants. All these many different combinations are things that are not one size fits all, and it is really hard, even with sending pictures, to kind of figure out what's best for you. That's why I'm here to help you, to help guide you, to really figure out what is the best for you. And a lot of times, whether somebody needs a lift or doesn't need a lift, I often take my fingers and bring the two edges of the breast together to see if my fingers meet. And I can't do that virtually, and I can't do that online. I can only do that in person. And that's why I encourage all of you, or any of you, to learn and be educated, because it's so important to be an educated consumer. Lots of people want to know, what's the recovery from this operation? Well, it kind of depends on what you're doing, but in general, it's a pretty fast recovery. I sometimes say, if you really want to know it's about a week. And what does that mean? Well, you can go back to work in about a week. Can you go back sooner? Often you can. It all depends what you're going to do. Going back to your Pilates classes and gym class, that's more like 3 weeks till you can start doing some exercises, and you really don't want to engage your pectoral muscle until about 6 weeks after surgery. And the general recovery, I give patients usually a non-narcotic type of medicine to take a couple days before, like an anti-inflammatory that doesn't make you bleed, so that then you don't need so much pain medicine, although I do prescribe some pain medicine if you need it. You have a supportive bra for the recovery, and in general, just think that your elbow's attached to your side, so if you need something, you go towards wherever you're going, and you don't want to bend over too much in the few days after surgery. It's generally an easy recovery, and something that I always try to under-promise and over-deliver. And so when I tell you it's about a recovery for a week, to be able to go back to work, I think that's a good estimate.
Thank you everyone so much for staying on, attending tonight. Please remember to stay till the very end. Each of you will receive a text message. If you'd like to learn more, schedule a consultation, just reply back with the text message and I will reach out to you in the days to come. We are also doing a live Q&A with Dr. Korman here next, so type your messages in the chat box. They are anonymous, so don't be shy. We'll read them out. We'll try to get through everything, and Dr. Korman himself will be responding. And then last but not least, you will also be receiving a text if you are a raffle winner. So keep an eye out for that as well in the days to come. Thank you so much.